what do you think? What are some of the reasons for this hesitation in getting the COVID-19 vaccine?
Well, I think, and I've talked to a few of my, my African American community. It's trust, and not only trust, but the media. The media puts out all of these different theories, conspiracy theories, and then what it does is, and it also goes um, back to slavery, and our Black community looks at how patients were experimented on. They look at when men were tested with syphilis. These are all the things that I hear.
Oh,
Yeah. They're looking at, oh, this vaccine came out too fast, but they don't realize that this was being developed way before, it hit. And then also, thinking back and looking at the Henrietta Lacks story, when a woman who was diagnosed with cervical cancer was receiving treatment and had, samples taken from her without permission. So that's something else that they look at. Oh, so they're stealing things from us. And so it's like all trust and these conspiracy theories and all these different, things that are being looked at.
Justified. I mean, those are justified trust issues, which I think we need to really embrace and say that those aren't unrealistic things to be concerned about.
I think and echoing what Ava said, our memories are long, and the history of experimentation on people of color is also a long history, right? And so that general mistrust, there's so much work that needs to be done to rebuild trust in communities of color. And I think part of the way that we do that is through having representation, as Rachel had alluded to earlier, having more providers of color be front facing, be out in these communities and say, hey, I have a similar demographic to you. I have a similar background to you. I understand what some of your fears and what some of your concerns are, but here's the medicine and the science that backs it up. I think too that, because there has been historically, people of color have had limited access to care. Now they're like, oh, so all of a sudden we're going to be the first in line for this thing when, other things that have been important to us or the things that have been needed, we haven't had access to. And so again, that sort of goes back to some of what Avis was saying about conspiracy theories abounding about, what this vaccine is going to do, and how it may be specifically targeted to people of color. I mean, I had this conversation with my parents over the weekend. They're very hesitant about this because, again, it came out too quickly. All of the history that has played out in this country with people of color. So it is a very sensitive topic, and I think we, as providers of color, bear some responsibility to help rebuild that trust and to move that through our community so that they can understand that our hope is for their best interest. Our goal is to have them cared for equally and just as well as everyone else.
Right.
Yep. So in addition to mistrust and the timeline, as Patrice said, what some of my patients tell me, oh, it came out too fast. This is not right. So I take my time to explain to them that technologies have developed and they use technologies that have been used for a while. Some of my patients tell me, oh, we're not sure it's effective. So I take my time to explain to them that the vaccine is safe and effective. Also, for some patients, it's the mistrust added to fear of the unknown. Okay, if I take this vaccine, what is it gonna do to my body? Some of them start talking about what vaccines have done to little children. Some children have developed autism from receiving vaccines. And they will tell me, so what is this vaccine going to do to my body? So I spend time explaining to them that the vaccine does not even have live virus. It will not give them COVID. It is only to help. Also, I have had patients who have said to me that they're not concerned about the vaccine because they just don't believe in COVID. They don't think it exists. So I take the time, I give them my personal experience with COVID. And I say to them, okay, I understand how you feel. I always validate their feelings. And I tell them with every medication, anything we take into our body, even if it's food or drinks, we always have to weigh risks versus benefits. Okay? I tell them, look at me now, having gone through COVID, survived it, but look at what I'm dealing with. Do you want to go through this? Or do you want to take the vaccine that will help prevent it? Even when you take the vaccine, you don't have 100%. True, it's coming down. And I'm optimistic that there are better days to come. But for us to get through this, all of us have to pitch in to do what needs to be done. It takes about 70% of the population to get this vaccine to have herd immunity. So I tell my patients and my families, do it for you, do it for your loved one. It cannot hurt you. It can only help.
And just to echo what everyone else has said, there is great mistrust in the medical system amongst African Americans and minorities. I say this all the time. Working at the hospital, we receive some minority patients who may not be documented, and they come in severe illness, and they avoid the medical system for fear of persecution that, I have COVID. What are they going to do if they find out my family's not documented? Or what am I going to do when I get this bill? By the time they reach the medical system, they are so sick. Mm-hmm. A lot of times it's often too late. Right. But when you look at the history of America, especially when it comes to medicine with Blacks and minorities, there's a really good book that I've read probably about 3 times, and it just comes up a lot. It's called The Medical Apartheid, and it talks about the dark history of medicine with regards to Black Americans. There has been a long-standing and ongoing history of medical racism and medical violence in America with regards to Blacks and other minorities. And while we recognize it, there's still huge hurdles to overcome to break down those barriers. And when you're looking at medicine in communities of color and minority communities, usually those facilities are not the best facilities. So people already have a mistrust of the medical system, then they have a mistrust of the facilities in their community. When you look at things like the Tuskegee study and how Black women have one of the highest rates of mortality for childbirth and one of the highest rates of unwanted hysterectomies. And then you look at things like Sarah Bartman and what happened with her when she died. They took her organs, her reproductive organs, and put them on display. Black Americans are fearful and they just don't trust medicine. And I think a lot of that goes back to the underrepresentation of Black Americans in medicine right now. I can't tell you how many times I've walked into a room as a Black female medical professional, and it could have been another colleague that said the exact same thing, but my Black patient feels so much more comfortable with me because they feel like I'm coming from a trusting place. And there are other providers that don't look like me that are coming from a trusting place, but it's so hard to break down that barrier and really get people to trust what we're telling them. And that's why I've made it a personal mission of mine to go around and educate and speak at churches and other public venues about the COVID vaccine. There are a lot of myths. We know the telephone gang, and I saw it on social media. There's a lot of bad information out here circulating around. And I've been telling, my African-American patients, we cannot afford to be left in the dark here. We cannot you can't afford to be left behind, because we're dying at disproportionate rates due to COVID. So I think that once we can address that barrier of mistrust, which it's going to be a tall feat, but we have to continue to do it, I think we'll be able to get African Americans and other minorities to be a little more trusting in the system. But there's a lot of institutional barriers that we have to address to get there.
Yeah, agreed.
Right.
Yeah, I think there's a lot of great points here and a lot of layers of mistrust. So first, I wholeheartedly agree with regards to the Black community and reasons why they mistrust medicine, in particular, Tuskegee, amongst other things that have transpired, and even allocation of resources, which is part of, unfortunately, why Black people and people of color have suffered disproportionately due to COVID, because they have more comorbidities, because there was never the infrastructure in place in the first place to help address that or prevent that. The infant mortality rate in this country has been horrible for decades. It's something that hasn't been addressed. I think it's, an indictment of the resources that are allocated to minority communities, in addition to resources that are allocated to community medicine in general in this country, because medicine in this country is too often looked at as just a hospital. And it shouldn't be an or, it should be both. It should be for the communities and doing the right thing and providing the education. And then the other piece is just the vaccine in and of itself, and the distrust with how quickly it was developed. But again, as was noted in this discussion, that technology has actually been around for about 2 decades. So it's not new technology per se. It's just because of how quickly information is shared now, and really the world's need to try to develop a tool to address this best, that the vaccine came to fruition so quickly. And that's, I think, to me, while I understand the mistrust and I understand the concern, what I try to tell people is just that logically, I have no better tool for you at this point in time. So it's not remdesivir, it's not monoclonal antibodies, because if they were, I'd say, okay, I understand you don't want the vaccine because we have something else to help you. So that, combined with the variability and that you don't know, there's people that you think that are not going to do well and do okay, but then there's people that you think are going to do okay and they end up dying. And as an organization, we've cared for nearly 270 patients throughout this pandemic that are no longer with us, or very close to that. And that's a frighteningly high number. And so to me, I understand the concern. I still think from a logical perspective, the best thing to do is get the vaccine at this point in time. But I understand the concern, understand the hesitancy, and that's definitively something we need to address. I think it's important when, Lieutenant Governor Rutherford, for example, got vaccinated with his COVID vaccine. That's good to see Black people of, status getting vaccinated, to show that they know this is the best tool for us at this time.